Recording.
Okay, I'm Dr. Nick Araza, and this is the Bunion protocol to help people with bunions to slow the progression or to try to resorb some of that extra fluid that could build up right there at that first MCP. So first thing before you even get to the foot, you want to check the chain, essentially the kinetic chain starting at that right SI. You can look for either a PR sacrum, where the sacrum's posterior rotated on the right side, or look for an internal or an anterior superior on that ilium. So either an ASIN, IN, something like that that will end up driving that leg a little bit longer. Also, then you can look at the knee in terms of an anterior on the internal side here. And then lastly, when we get down to the foot, the areas you really want to focus on are first the talus. Usually it's a medial anterior talus, so when you set that first, this is the keystone to the foot. When that drops, or when it gets stuck, it allows for basically the breakdown of the arch. So you want to first start on this medial talus here, contact with essentially a finger contact there, and brace over it like that. And you're just setting it basically straight anterior to posterior with a little bit of S to I, or superior to inferior. So essentially just like this here. Okay, that would be the set there. You can also do it with a speeder board underneath there and setting it down like that. Okay. It should be less point tender once you've set that. Next, you want to take a look at the navicular. So usually with a person who has a bunion, which this person does not, but you'll have a dropped navicular, so you want to bend that leg, open that up, and you're just driving essentially dorsal to plantar, so just like this. Contact, you can do a thumb contact or just a pisa contact, and you just sit like that. Okay. A lot of times you'll hear a clunk on that. Then you want to move up to the this is metatarsal joint there. And I forgot that, so you want to have that at the base there. And with a bunion, usually this first metatarsal here has rotated in at that, so it's kind of done this. So you want to do the exact opposite, contact right at that where the cuneiform meets that metatarsal there, and you're going to just adjust in that opposite rotational motion there. Then we get to the actual metacarpal phalangeal joint here, GP, and what you want to do first is distract the big toe out and down like that, so you're really opening or making that bunion worse. You're going to contact over here at the top of it and pull down in that, so you're just going to feed that capsule back into the joint, and you're just kind of bringing that and pumping it in like that. This is really painful usually for people with bunions, so you're doing that 3 to 5 times. You sometimes feel that capsule set in there. Then you want to pump it a few more times just like that. Once you've got that, holding it like this, supporting that big toe, and then you're going to set down like that. And then right after that, you want to grab the sesamoids right underneath that MTP joint. And for this, you kind of look around here. So when you do this, you grab usually medial, and you're really setting those sesamoids back from inside or the outside of the foot towards the inside of the foot. So it's like this, and you're setting it down like that. You'll also put pressure through that first MTP. So it's grabbing onto those sesamoids and setting down like that. That's usually also very painful. Okay. Last thing I like to add to that is really trying to help recreate this secondary arch. So we have this first arch right there, and then there should be a secondary one right along the ball of the foot. So I push in like that, and we grab along the tops of the foot there, and just kind of pull in and squeeze. I'm just trying to help recreate. The other thing that's really important for bunions is that they need to start exercising their feet and get them stronger. So I have them do basically making fists with their toes. Go ahead and do that. Yep, just squeezing the ground like that. They can do it sitting in a chair. I also have them try to work on spreading the toes apart, really trying to help work on the muscles that basically connect in there to try to help pull that back, because usually a bunion, it's really in like that. I've seen people get moderately better, and their pain usually goes away. So it usually takes a good handful of adjustments, as well as them working on it every day. Usually I tell them about 30 squeezes a day. They can do inchworm with a towel or something like that. But that's the bunion protocol, and you just keep repeating.